Okay, I'm going to wrap so as to leave us a couple minutes for questions. And then the final thing are the incentives. And I don't know how many physicians, healthcare professionals we have in the room, but this is a big chunk of funds. This is bigger than what we got from MIPA and the e-prescribing provisions. This is, you know, if you, in your first year, and if you start out early, they begin in 2011, and they extend over 5 years, and then they sort of move down as you move forward. If you start right off the bat, it's $18,000. You know, if you're going to buy purchase and implement a fully EMR or EHR, it's probably not enough, but it'll get you a long way. And plus, you're going to be getting incentives along the way. So it's a good chunk to help physicians move forward. 18 or 15, depending on when you start, and then ratcheting down to 12, 8, 4, and then 2. And in addition, if you're in an area designated as a healthcare professional shortage area, your fees can be increased by 10%. Okay, so we're going to have, just like we've seen with the other programs, the e-prescribing, in the first year's a bonus, and then we'll start to see penalties. Actually, they begin in 2015. They go to 1%, and they go up to 3% by 2017. Now, look at the bottom in the text box. So in 2018 or beyond, if we aren't at 75% penetration rates, you know, because this has been scored, they believe this is aggressive, right? Every American, you know, this is a big number, 75%. It's going to be a crazy few years, isn't it? You know, if we don't get there, then the Secretary has the option of increasing these rates by 1% per year, but can't go above 5%. So that's a lot of money, particularly in a small physician practice. So this is the real deal. This is going to happen. And then, you know, there are some hardship. You know, hardship could exempt you from having to pay the penalty. The Secretary will determine this. There are all sorts, in the interest of time, this is the last area and something that I know you'll be thinking about. In order to qualify for the incentives, 3 things need to happen. You need to have meaningful use of that certified EHR technology that we talked about earlier. You need to have information exchange, and you need to report on quality measures. And so CMS is going to be spending a lot of time, the devil's in the details, on how, what all of these things mean. We talked about them earlier. Particularly information exchange is an area where there is no, we need a lot more detail, but that's goodness. I mean, I think that's very exciting, and it will highly support that work that you're doing here in central Pennsylvania. And then reporting on clinical quality measures will be required. We don't have time to talk about the hospitals, but it is significant in terms of their incentives, up to $16 million over 4 years, based on a complicated formula. There's also some money for Medicaid. So what does this mean for you? It means this is perfect timing as you, in closing, I'm going to wrap now, as you move forward, where you are with your initiative here in central Pennsylvania. You know, help is in sight. I think that there will be significant grants and possibly loans that will support these exchanges. We're clearly going to have technical assistance at the regional level, and perhaps that's something that you want to move forward on. We are going to see those Medicare incentives, and that'll provide the certainty that the market needs, and many need, that often stand, you know, waiting, that this is indeed happening, and that will be very important. And then finally, we've got some guardrails for privacy, because that's a big issue. I don't know how big of an issue it is in this market, but certainly in other markets across the country, it's an area that we talk a lot about. So what can you do? Standards will move fast and furious. Pay attention. Get involved. This is going to move fast. It's going to have a big impact on what you do. Maybe you want to explore this regional extension center concept more so in Pennsylvania or in central Pennsylvania. You're going to want to get connected, as you already are, with state-level activities. Review those privacy provisions carefully. And the big thing is where tremendous opportunity as a country here and locally in every market to use this health IT infrastructure as a foundation for really improving the quality, safety, and efficiency of care. And we need to do that. And the language doesn't force us to do that. It's going to be in the effective implementation, and I'm sure that those that are developing policy in this area will help to make this happen. But that's something that you can do here locally as you get these funds to make sure that all of these investments are used in a way that will ultimately improve the quality of care. And so you're making great progress here in central Pennsylvania. You've got all the right elements around engaging multi-stakeholders, having a public-private sector collaboration. And so good luck and congratulations, and I'm delighted to be here with you this morning. I think we have time for one or two questions. Two questions, Kelly tells me. Any questions? Sorry, I moved through that very quickly. Yes. Good morning. Thank you.
The dollars that are available for training. Right now, we're looking at a shortage already of qualified healthcare IT staff, and also about educated professionals within the provider environment for implementation forward. Are there dollars specifically available through this legislation to bring more professionals into the field, and to, particularly with all this money coming up, to help set the groundwork and then provide IT support after all this information technology comes up?
Yes, and thank you for that question. And I actually glossed over those slides really fast in the interest of time, but there is there's significant funding. Well, who knows what the dollar numbers are, but as part of the $2 billion bucket, we're not used to using the B word, there are grants to be matched to educational institutions to support at multiple levels medical informatics and to help with training of professionals. There's also another program that's designed to help those programs. So there's a significant emphasis, several pages of language that recognize the problem that you've articulated around not only educating clinicians as they move through the process on informatics, but also a whole range of other individuals who will help to address this shortage. I think we have great potential to create jobs in our country through this language. We need a workforce, and there are folks that aren't working, and so it's going to force us to convert this knowledge into things that can be spread and accelerated across the country, but it feels like a great opportunity, not only for healthcare, but for the U.S. Thank you. Physician, not practice, physician. And it also applies even if you had your EHR before. Doesn't penalize you for late purchase. Technically, yes, but there are some provisions and formulas in the language around physician practices. But yeah, sort of, pretty much.